Welcome to Toledo Clinic TV. Our guest for this segment is Dr. Aaron Pumerantz, and he is a rheumatologist. And we're going to talk specifically today about rheumatoid arthritis. What exactly is that?
Yeah, thanks for having me on today. Rheumatoid arthritis, it's approximately in 1% of the adult population. Approximately 1 to 2 million U.S. citizens suffer from rheumatoid arthritis, and it's an autoimmune disease whereby the immune system inappropriately attacks itself. So it attacks healthy cells. Chronic inflammatory arthritis is essentially the main diagnosis.
So we think pain in the joints, is that?
So as far as presentation and briefly discussion of how do we diagnose rheumatoid arthritis, essentially patients presenting with progressive, chronic, so over 6 weeks, of inflammatory arthritis, typically in the peripheral joints, so hands, feet, toes, fingers, morning stiffness lasting more than 30 minutes. So it takes about half an hour for the stiffness that developed overnight to work its way out. Swelling, tenderness, pain, these are cardinal features of rheumatoid arthritis.
And so what is it that a patient should do if they start to experience some of those symptoms? Come directly to a rheumatologist, or are there other avenues?
Yes, excellent question. So if you're a typical presenting patient, middle-aged female more prevalent than middle-aged males, and equal prevalence in the older population, if you're presenting with over 6 weeks of inflammatory arthritis symptoms, swelling, pain, stiffness, you should be seen by your primary care provider to start the initial workup, which will include a thorough history and physical, excluding things like viruses, other diseases that can mask as rheumatoid arthritis, psoriatic arthritis, inflammatory bowel disease. These things need to be considered. And then risk stratification, so thinking about whether or not you have a family history of rheumatoid arthritis, whether or not you're a smoker. These are things that increase your risk. And at that time, being seen by a primary care provider, they'll do a thorough examination, looking for tenderness, swelling, and then also start a laboratory workup. So looking for blood work, evidence of inflammation.
And what would the treatment options be for someone who is diagnosed?
Well, this is one of the most exciting parts of our profession, specifically with rheumatoid arthritis. Over the last 1 to 2 decades, rheumatoid arthritis has seen the paradigm shift, if you will. So the advent of new medications that can halt the diagnosis and the symptoms, the progression of joint destruction, the inflammatory process. We can halt it in its tracks. We can control the disease and ideally place it into remission. But the goal is early detection, early diagnosis, and aggressive treatment.
Okay, thank you so much for all that important information. We'll be right back.